My name is Lauren Stewart and I'll be doing the medical administration checkoff for this video. As we can see, I start off, I'm in the College of Nursing dress code policy. I'm following it. And so the second thing I'm going to go over is the patient today, going over matching the MAR sheet to the patient care order form that we are given. So we see today that we are doing heparin 5,000 units subcutaneously every 12 hours, and we're going to match that to the patient care order form. So medications is heparin 5,000 units subcutaneously every 12 hours. We're also going to match some of the identifiers of the MAR sheet and our patient care order sheet. So two patient identifiers would be Jaguar Jones, the medical record ID number 4176352, 4176352. And we can also go ahead and make sure we're in the correct room or going to the correct room. So room 2040, room 2040. And we're also going to name off allergies, which is penicillin on the patient care order form. And allergies are penicillin on the MAR record or the medication administration record form, okay? So those are my identifiers, two patient identifiers that I needed for. So I'm actually going to move my phone so you can get a better view of what I will be doing during this video. There we go. And I'm going to perform some hand hygiene before we get started. So before I get started with my medication and going over that, I'm going to go over the 5 right of medication and administration rules. So we go by right medication, right dose, right patient, right route, right time, and we also go by the 6 identifier, which is right documentation. So I'm going to select my medication. So what we're looking for today is heparin, which is here, and with mine it says that the unit says 10,000 units per milliliter. We're also going to check the expiration date, which is 12/5/2020, so it's in good shape. And I'm also going to verify that the time that I will be administering the heparin, which is 07:01. So, and this is 1500 hours military time. So with this being 10,000 units per milliliter, we're administering 5,000 units. So I will be giving 0.5 milliliters in a tuberculin safety syringe. So what I should be using is a 1 milliliter tuberculin safety syringe, but they left that out of my package. So all I have is a BD 1 milliliter tuberculin syringe. It doesn't have the correct end that it's supposed to, and I've already called the library or the bookstore about that, and they should be getting me one soon. So I'm going to start by pulling my syringe away from me to get it out sterilely out the package. And I'm also going to take an alcohol wipe swab, and I'm going to go over the top of my heparin vial. So I'm going to swab the top with an alcohol swab. All right, and then I'm going to remove this and get 5 milliliters or 0.5 milliliters of air in my syringe. And I'm going to place it into my vial, flip it over, aspirate into it, and I'm going to get 0.5 milliliters into my vial. I'm also going to go a little bit over so I can get rid of any kind of air that's stuck in my syringe and get that out by pressing. All right, so now that I have 0.5 milliliters, I will get my syringe back on by the scoop technique, and then also showing that I have 0.5 milliliters in my syringe. All right, so now I'm gonna compare my medicine with my MAR, make sure they're right. I got the right amount, which is 0.5 milliliters. And then I'm gonna take a label and label the type of medication that's given, the name of the patient, the amount. So I'll put heparin, 0.5 milliliters, of 5,000 units, and I'll put Jaguar Jones. And I'll tape it around my syringe, as seen. And so now I'm going to put everything in my basin that I will need when I go into the room. So I'm going to put my syringe. I'm going to take some heparin when I go, just in case. I'm going to take some extra alcohol prep pads to go with me. And I'm also going to take my MAR sheet and my patient care order form with me, okay? So, coming into the room. All right, and then I'm going to go over 2 patient identifiers. So we see that the name is Jaguar Jones. We see that the MR number is 4176352, and that's the same number that's on our patient care order form, which is 4176352. Same name, Jaguar J. Jones. We're going to go over the allergies. The allergies are penicillin. Allergies are penicillin. I'll also ask Mr. Jones about any kind of other allergies he has. He states none. We'll make sure not to give him any kind of penicillin for this visit. And then I'm also going to ask if he's taking any kind of interactive drugs like aspirin, which could affect the effects of heparin. So any kind of pre-administration assessments for heparin, I would do so like activated partial thromboplastin, which is something I would test for. I would take blood pressure, and then ask if he had taken any kind of other medication. So then I would restate my 5 rights by the medication administration. So the right medication, which is heparin, which I'm given, the right dose, which is 0.5 milliliters, the right patient, which is Jaguar Jones, the right route, which is subcutaneously, and the right time, which is 7:01. And the 6th one, right documentation, which I would do at the end. So I'm going to explain my procedure to Mr. Jones. So what I'm going to be doing today is feeling on the right side of your abdomen. I'm going to wipe it with an alcohol wipe, and then I'm going to give the medication. And before I insert the needle, I'll let you know, and it'll be a small stick today, so it'll be a small bit of pain. So now I'm going to raise my bed and lower my side rails. And I'm going to put on clean gloves and my glasses, but I'm also going to perform some hand hygiene before I do those things. All right, so now I'm going to start with my gloves. And then I'm going to put my glasses on. So now I'm going to be doing the injection site on the right side of Mr. Jones' abdomen. Here, I'm going to move that. So I'm going to be taking an alcohol, and I know I broke sterility by moving that, but I wanted y'all to see. So now I'm going to take my alcohol wipe, and I'm going to clean the area of where I'm going to be making the incision with my needle, moving in a circular motion, and I'll be going counterclockwise. All right. And I'm going to be injecting my medicine today at a 90-degree angle. So I'm going to take the lid off. I'm going to pinch the skin. And I'm going to insert. And I'm going to give the medicine at 15 to 30 seconds to not give it way too fast. All right. So now I'm going to recap my lid. Get rid of it and apply pressure. Make sure I don't lose any of the medicine. All right, and now I'm gonna make sure that my patient is comfortable, and I'm going to re-raise my side rails. I'm going to check for any kind of allergic reaction, and then make sure he's not having any kind of allergic reaction to the medicine, and then I'm gonna get rid of my gloves, glove to glove, and then skin to glove, and dispose. And now I'm gonna do the 6th route of medication administration. So now I'm gonna document how Mr. Jones reacted to the medicine, the procedure of it, and then the patient response to it. And I'm gonna do hand hygiene. And I'm gonna document all of those things on my medication administration record, so what time I did it and how I did it. And then I'm also going to document that on patient care order form, all right? And so then I would take it back to the nurse's station, and I would put these things in the computer for him too. And just to go over like how he did with it and how he reacted to the medicine. So now I'm gonna move my camera so that I can assess different places of insertion. Come here.
Okay. Okay. What do you mean to do?
All right. Do your hands like this.
Okay.
I'm gonna do the deltoid, which is 3 fingers, about right here. All right, so now I'm going to do the vastus lataris, which is, you'll have to turn that way.
Which way?
Turn back that way.
This way?
Turn this way.
Okay.
All right, and I'm gonna move my phone so you can see me do these.
Would you like me to hold it for you?
Yeah.
Okay.
All right, so it's mid-thigh. You're gonna have to
Okay.
hold it over.
Oh.
Hold it this way.
Okay.
So about in this right here is where it would be, and then we're gonna do the ventrogluteal injection.
Okay.
Which would be in the middle of the triangle, about right there. Okay? And so after doing these injection sites, I would go back and reassess my patient's response to the medication now that he's had some time. So, and this is the end of my medication administration video. Thank you so much for watching.